Living with a partner can be challenging for anyone. Each person has to consider the feelings and concerns of the other. Compromises are key. Each person has to be committed to meeting both their own needs and also the needs of the other. When one partner has a mental illness, there are additional issues that have to be taken into consideration. Often there are questions that people without the mental illness have about their ill partners. We have included some of those questions, along with answers we hope will help you as you navigate your relationship.
How can I best support my partner without making her angry?
When she is struggling, ask her how you can help her. If she says you can't, then step back and give her space. Let her know that you are supportive and that you are there for her if she needs help. The key is understanding that, like anyone else, sometimes those struggling with mental illnesses need to sort things out before they accept help. Sometimes even knowing what kind of help someone wants or needs can take time. In the meantime, be as supportive as you can while respecting your partner's request for space and time.
Sometimes the symptoms get so strong, I get scared and feel like I should call someone. But I know that if I do, it will damage or possibly end our relationship. What should I do?
Your number one priority is to keep your partner, your kids, others, and you safe. Therefore, if you feel she needs help, call someone, a relative, a friend, or the police if necessary. Often, even if the individual is angry initially, most often they get over it, and once they are stable, they realize that it was necessary. But regardless, the well-being of all involved is most important.
What do I tell our kids when their father isn't well?
Depending on the age of your kids, you might simply say that dad isn't feeling well. Or if they are a little older, you might explain what mental illness he has and provide them education so they can begin to understand the illness and so they understand how their father is responding to it.
If my partner has a mental illness, does that mean they will have it for life?
Many mental health conditions are reoccurring in nature, meaning they can come and go. There can be periods of remission where symptoms are gone and may be so for long periods of time. Managing one's stress can be a really big component of keeping additional cycles at bay. Lifelong recovery should be the focus. This means practicing daily wellness activities to function optimally. Whatever that looks like for that person, an active, healthy, robust recovery plan can help keep symptoms at bay and may even reduce the need for medications.
If my partner has a mental illness, does this mean they won't be able to work?
Not at all. There are many people working and living with mental illness. 1 in 4 individuals are impacted by mental illness. They are in every profession, fulfilling many roles and responsibilities in life, and they do not let the illness define them, any more than diabetes or asthma defines a person. Remember, this is an illness, not a character flaw. One's individual abilities, talents, and capacities are still a part of that person, even when severe cycles of the illness hit. There may be times when the illness impacts one's ability to meet the schedule and demands of work, and it's important that during those cycles, your partner talks with his or her therapist and doctor about potential reasonable accommodations at work that could help him perform the duties of his job during difficult times, and how to most effectively have that conversation with your partner's place of employment.
How can I learn about my partner's illness so I can be supportive?
There is a vast amount of information out there with access to the internet, books, articles, blogs, literature, magazines, and support groups. Finding legitimate, valid information is critical to educating yourself effectively. Speak with professionals who can recommend legitimate, quality sources. Contact the national and local chapter of NAMI. Your local chapter of NAMI will have information and resources on community groups for families, spouses, and siblings. Participating in these groups can connect you with other family members who are walking a similar journey. Additionally, some mental health professionals offer family consultation services and can meet privately, one-on-one with you to address your unique family situation. In a confidential setting, you can receive support, guidance, and education about the impact mental illness is having on your partner, your family, and you, and what you can do to reduce the disruption and keep everyone safe and healthy.
How can I help my partner take her medications and make sure she practices healthy habits?
The key part of your role is to remember where your control lies and where your partner's control lies. No one can make you do something. So if you'd consider how you'd want to be supported if you had medication to take, it will guide you. Make sure your tone, attitude, and behavior conveys respect. Try not to nag or make threats. Doing so rarely works and more often causes further resistance and increases the tension in a relationship. Encouragement, support, positive reinforcement, and respect are the key ways that you can support your partner's healthy habits.
What should I do when my partner doesn't follow through on his appointments or taking his medication? What should I do if my partner is so sick that he is not functioning?
It's concerning and scary watching a loved one suffer with any illness and not take the necessary steps to take care of themselves. With mental illness, this is only compounded as many attributes of the illness directly impact energy, motivation, desire, perspective, and interest. Remember where your control lies and balance this with a respectful, honest approach. Share your concerns thoughtfully, lovingly, and honestly with your partner.
Joe, I'm watching you struggle every day and it's really concerning me. I see you're having difficulty going to work in the mornings. I notice being around us is difficult for you and you want to retreat more often to your bedroom. I'm concerned that this means you're really struggling with some symptoms that are hard to manage right now. How can I help you? If your energy is low and you're having difficulty following up on things, are there ways I can support you? Are there things you need some assistance with to make sure you're getting to your providers to talk about what's going on? Would you like me to contact them for you or go with you to an appointment?
Sometimes people with mental health challenges do not know they are ill. In these cases, they might argue that they're fine. They may even become frustrated or angry when they are told they need help. In these cases, when our partner is so sick that they are no longer functioning, it is not only appropriate, it is necessary to take a more active, supportive role and reach out to their providers to convey your concerns and get their guidance.
Many friends and family members ask how my partner is doing because they think that because she is the only one with the illness, she is the only one suffering. I don't often have others ask me how I'm coping. How do I find support for myself where I can talk about how this illness is impacting me, as well as my family and my marriage?
It is not uncommon for the support partner to suffer silently. With almost any illness, the person who is sick is the one who naturally draws our attention and concern. It takes conscious intention and action on your part to reach out to others you feel safe talking to and who you feel can respond effectively to your needs. It means opening up and being vulnerable, which is uncomfortable, but the potential for great comfort, support, understanding, and guidance far outweighs the risks of vulnerability. It takes courage for your partner to reach out and ask for help, and it takes courage for you to do it as well. Consider finding professional outlets for support for yourself, whether that is in the form of support groups, online or in person, or mental health professionals who can support and guide you. And don't forget, we are all on a recovery journey of some kind. Your wellness is important to your psychological and emotional health and well-being. Making time for you and the things that you enjoy is important to prioritize daily and weekly. Even when your partner is struggling, it is all right and even necessary to find enjoyment in your own life, to do things for you, to go out with friends, to do things that help balance your life.
Can I contact my partner's providers when I'm concerned about him and his well-being?
It's most ideal if our partners sign releases for us to have periodic contact with their providers. Having this conversation during times of wellness and health is critical. Releases allow for reciprocal communication between you and the providers. Without the release, you are still able to call your partner's providers and share your concerns, but they are unable to go into any specific details about your partner and their treatment. However, they should be able to listen to your concerns and provide some general guidance.
Is it ever okay to think of leaving someone with a mental illness? Am I responsible if they become suicidal?
There are certainly times and situations when it's absolutely appropriate, even necessary, for one's own health and well-being and that of their family to consider ending a marriage. This is a personal decision that must weigh many factors, including each individual's unique tolerance and patience for what they can and can't endure. This is a serious and impactful decision and should be considered carefully and with the support and guidance of trusted loved ones and or professionals. Healthy habits and boundaries are important for all of us to practice. And if you are a parent, you also have to weigh what you are practicing and modeling for your children. Children learn behavior primarily from their parents and loved ones. Many times, it takes deep reflection on what we are teaching our children through our own behaviors and decisions to determine if staying or leaving is really the healthiest step for ourselves and them. Oftentimes, the decision to leave can create a crisis state in the family. The partner who is ill may become acutely upset and fearful and may turn to some destructive or self-destructive behaviors or tendencies, such as drugs or alcohol use, excessive partying, and other risky behaviors. He may become withdrawn and maybe even suicidal. If you feel that your partner may harm himself, contact any professionals he is working with and let them know of your intent to leave. They will be able to intervene. If no professionals are immediately available or the risk is immediate, call 911 and tell them exactly what your partner is doing and what your concerns are. If you have a partner with a mental illness, you do not have to suffer alone. There is help out there. For more information, contact us through our website at www.transmhs.org.